so I'll call. And the first item on the agenda is the approval of the agenda.
Well, how's all?
I did, roll call, oh, it's right. Excuse me.
You're skipping right through it.
Clarence Campbell,
Here.
Richard Huber,
Here.
George Busse.
Here.
Laura Negro,
Here.
Dr. Keller,
There.
Dr. Horny.
Here.
Here.
Now. When you get to it, maybe clean it. There's two public comment sections on the agenda. We'll explain that when we get to it.
I'll make a motion to approve the agenda.
Motion made and seconded to approve the agenda. All in favor?
Aye.
Opposed? Motion carries. Minutes of the previous meeting, 15th meeting. George?
An observation. I'm going to be totally embarrassed if under section 4B, I actually said that the psychiatric contract with this program and if they were overloaded or unloaded. I didn't report you.
I can't hear you guys that well.
I'm saying that at the last meeting, I did not say that things were unloaded. I said that they were underloaded. Thank you.
Still can't hear you. Can you try to move the owl more to the middle of the table?
You talked about those owls.
As far as it goes. It's a bear.
Maybe Clarence, can you try to say something?
Can you hear us?
That's a little bit better on my end. George, can you try to say something?
The owl is not rotating. Is it supposed to rotate?
No, it rotates in the inside that glass piece on the top.
Oh,
It seems better to me, Tasha.
Yep, definitely seems better on my end. Is it okay for you, Liz?
Yes, it's better.
Thank you.
Sorry.
We'll try to speak up.
well, you didn't miss anything so far.
Do we need a motion to approve the minutes from the April 16th meeting?
I'll move that.
I'll second.
Motion by Dr. Keller, second by Joy.
Yes.
All in favor signify by saying aye.
Aye.
Motion carries. Public hearing, we'll need a motion to go into public hearing for the purposes of developing the 2026 budget.
This is Laura. I'll make that motion.
George Busse will second.
Motion by Laura and George seconds. I believe that's a roll call vote.
Clarence Campbell,
Yes.
Richard Huber,
Yes.
George Busse,
Yes.
Laura Negro,
Yes.
Dr. Keller,
Yes.
Dr. Horny,
Yes.
Joy Henderson,
Yes.
Elizabeth Franick,
Yeah.
And then Laura.
Motion carries, and we have nobody in the room here that I can see that from the public to make comments on the budget development. Anyone online? I don't believe that there's anyone online either. We'll keep the public hearing open during the course of the meeting and close it at the end of the meeting. And in case anyone comes in and wants to make some comments. Next item on the agenda is the 2025 year-to-date expenditures.
Hello. So that's included in your packet. Tasha, you got, oh, yep, she's got it, Sharon. Thank you. I did include a copy of last year's just for reference. I know you guys like to see that. I don't have a whole lot to report on here. It's looking exactly as I expected it, especially compared to last year, we're right on track, to where we normally would be. A little bit behind on percentage, but that's normal. This is through April. Uh, the first month or two of the year, you were still doing stuff for the previous year. So overall, I think it's looking pretty good so far. Does anybody have any questions on this report?
Any questions? Hearing none, we'll thank Amber.
Thank
We'll
you.
move on to 6B, request for social worker 3 position in the adult unit.
So we had approval when we did the wage study to have a couple of social worker 3 positions, and we haven't filled them yet. However, it's become apparent to us with the growth of the Children's Long-Term Support Program, which is not technically an entitlement, but anybody who's eligible needs to be admitted to the program. So it has grown exponentially since they made that unofficial entitlement. It's a very, very complex program, and the number of children just continue to grow. Other counties, including Bayfield, have hired a mid-level supervisor for that because there's just constantly approvals that come in that need to be approved and make sure that it's all in line with the manual that directs the program. Authorizations need to be done. It's become way too much for Tasha to do with all her other positions that she has and the supervision that goes with that. I mean, I think you're all aware she's the ADRC branch manager. She's the adult mental health and AODA, that whole adult unit supervisor, and she's the ADRC as the 5 county consortium. She's the director for that. So this program is just too all encompassing, and it's just not feasible to do that anymore. The good news with this is because it's an unofficial entitlement, they have made it when they made it that before we used to get an allocation and you could serve as many kids as you could serve with that allocation. But now it's some sufficient at this point. So almost all these expenses for this social worker 3 position should be able to be captured either through WIMCR, the Wisconsin Medicaid reconciliation program that we have. So you can go and get uncovered, unbilled expenses through WIMPR. Or we also envision this person to have a caseload and also be working as a case manager with some kids. So kind of taking some of the pressure off the other case managers that are there, but having that supervision piece, the mid-level supervision. So it's not an exempt employee, they're not salaried, but they would be at a higher pay grade and have a lot more responsibility than a regular case manager. Tasha, did you want to add anything?
I think the only other thing that I would like to add would be also part of this position would be this mid-level supervisor position would also be responsible for entering all of the authorizations. So everything with this program needs to have a prior authorization, which currently our fiscal department is doing. And we're doing a lot of it's taking a lot longer than it really needs to take because the case managers fill out a form, I approve it, then it goes to fiscal for fiscal to enter it, for it to be submitted to the state, where this position would do, the case manager would receive the form or fill out the form, give it to this person, and then this person would enter it, taking out all those middle pieces, and that would just also be a huge time savings for several staff. and also help fiscal out with the amount of time that it's taking. Because then if, say, something's denied because of maybe an error or something, they're having to come back and check again where that this position would have more of that knowledge to start with, being in that specific role. So I think that's another advantage to utilizing the social worker 3 position with a CLTS basically supervisor.
So if you would approve this, we'd ask for a motion to forward it to the executive committee.
So I'm just gonna ask if that's what you're asking us to do. Laura,
I'll make that motion.
A second.
motion made and second, motion by Laura, seconded by Joy to request that we send this request to the executive committee. George?
Yeah, explain again where it fits into the budget.
So this program is sum sufficient. So you can capture your, so it's very complicated. We have to authorize ourselves in the program to provide case management. This person would be doing some of that. That we get, we do it through a third-party administrator type system, and we get funded just like submitting an insurance claim would work.
Okay.
And then any of the admin duties, some would be billable, but whatever's not billable, we can capture through the reconciliation program through the Wisconsin Medicaid system.
So it effectively doesn't really have an impact on your
It should not.
fund request. Okay, thank you.
Any other questions? Otherwise, the motion has been made to request of the executive committee the opportunity to fill this social worker 3 position in the adult unit. All in favor, signify by saying aye.
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 Opposed? Motion carries. Now we get to item C, open discussion and input comments to be passed on to the Ashland County Planning Committee for the purposes of regard to the upcoming county comprehensive plan. George, maybe you can just explain to some of those members who aren't on the county board what this entails.
Okay, so I've requested this item on all county committee meetings for the balance of the year. Sometimes things have to be repeated in agendas meeting after meeting before they start to get any traction. People start to think about it. So I have to chair the planning committee, and we're ramping up on developing the new comprehensive plan, which has to be published by the end of 2026. So we have time. But that, that plan looks out 10 or 20 years, and the county is required in its future actions, ordinances, resolutions to be consistent with this plan unless there's exceptional reason to be otherwise. So it's fairly significant that we think ahead about what we want to be 10 or 20 years from now. So we've asked each committee to think about, from perspective of, say, this committee, what do we think we want to be prepared to be working with, how we want to be working, what we want to be 10, 15 years down the road. So the first things that come to my mind for Health and Human Services, well, I think health, so I'm thinking air quality, water quality, and are these things that the department will be engaged with? And do we have any thoughts that we want to contribute to the long-term planning? It's basically an invitation to contribute to the long-term planning for the county from the perspective of this committee. So
George, by the way, is the chair of this committee, and I think Liz is also on the committee. Two of our board members are also on the planning committee.
So Liz is focused on cultural resources and cultural facilities, which is one element of that plan. The element I'm focused on is transportation and utilities. So Health and Human Services comes closer to Liz's element of this plan, which is a legislative required element of the plan to be submitted to the state. The plan is required by state statute for every county. So if there are thoughts that want to be brought forward, they can be recorded in our minutes, and that becomes a vehicle for documenting it as input. There's nothing to be said at any one meeting, shortens the meeting.
This will be on each meeting agenda for the rest of this year. And then later on, we also have a public comments section where people from the public can make input regarding the comprehensive plan.
Yeah, so we have a legal responsibility to the community to first announce to the community that we have a meeting in which they can make input, like we do every meeting for the public input at the beginning of the meeting. But if on our agenda, there is an item for us as a committee to discuss this particular item for long-term planning, having the second public comment period toward the end of the agenda restricted to comments about the long-term plan gives any public person who is online or at the meeting a chance to react to what we've been saying. And again, it might just be check another item off the agenda, but that's easy for us to do.
So with that said, anyone have any comments to make at this time? Otherwise, we'll move on and continue with our agenda. 2024 annual report.
Number 7. On my agenda, it's number 7. I think it's
7A.
7.
7A, 2024 annual report.
Oh, I must, I'm old. Yeah, I forget. Oh, yeah.
Trick.
You want to do it?
Surprise. Never mind.
So do we, go department by department like we normally do? And
Yeah, and so each department will kind of go alphabetically, however it's set up in the report, and each department will just give you a few highlights from their report, but I think it's usually adult services first.
Just scrolling down to there. I have my notes, but I want to kind of follow them in order of,
Okay.
and I'm sorry, I can't turn my camera on. It keeps saying my connection's unstable if I do, so. So first within the adult unit, just again, like Terry said, alphabetically is the ADRC. We really didn't see any significant changes in 2024 compared to 2023. Other than there was a few more enrollments, but not really a whole lot. It's really pretty consistent with the ADRC. We definitely, throughout the entire adult unit, the situations continue to become more complex than they used to be. They're more time consuming, but no big changes otherwise. The graph for adult protective services is really, when you just glance at it, is really deceiving because it looks like we had way more investigations in 2022 than we had in 23 or 24. But that really isn't the case because it's just a kind of a snapshot of the graph. Pretty consistent with 2023. Definitely down a little bit still from 2022, but I would say about the same. Our changes in guardianships and protective placement, also really not much change. I think probably the thing I'm most proud of in the adult unit is our adult emergency detentions. We continue to see that number decrease. And again, not that there was a huge decrease from 2023 to 2024, but those are generally the placements in the adult unit. If we have somebody who goes to Winnebago or Trempealeau, those really high cost placements, those are coming from emergency detentions. So we continue to work really hard to have good relationships with the Sheriff's Department and the City of Ashland PD, the hospital, Northland Counseling. Just really, we try to look at the situations. If we know maybe somebody's really struggling, we work with the other partners that they're involved with or the other programs. We work with CCS, have good communication with them, just to try to get supports before somebody needs to look at going not voluntary to a placement, regardless where that might be. And then kind of along with what we were talking about earlier with the social worker 3 position, we continue to see the number of families we serve in the CLTS program increase. At the end of 2024, we had 58 kids enrolled. We had some age out, some just disenroll, whether they didn't need the services anymore or they just moved out of the area or we lost contact with them. They weren't wanting the services. But we continue to see referrals come in at a pretty high rate for that program. A lot of months we're seeing 5+ referrals, which when you think about it is really a lot of kids throughout the county that have the level of needs that they could potentially, without supports and services, need to be looking at not living in their homes or in the community. So 58 families, I think, and I know this is for 2024, but I think currently we're at 60 or 61. So even just in the last several months, we've had, I think, 1 child age out, but we've gained a few more. So it's just an ever-growing program at this point. Otherwise, I think those are really the highlights for the adult unit.
Questions for Tasha? We'll move on to child support.
Hi, everybody. So I don't really have a ton to share with child support. I tried to make my annual report a little more, not as much of me writing and more little things for you to look at to get you to know our office a little bit more. Our office has not changed. It's been pretty stable over the last year. You can take a look at it and you can see the services we provide. Hasn't really changed. The one thing I do want to really highlight this year is if you can scroll down a little bit, Tasha, or whoever's, or I don't have control over this, no. So you can see right there that our funding is performance-based, and these are federal performance measures. So the state gets money and then it's given to each county child support agency based on their performance. Agencies must reach 80% in each of the federal performance measures in order to receive the full funding available that they could possibly get. It's really hard to accomplish. We have been working, I have to give more credit to the actual caseworkers than myself, but honestly, it has been a team effort. We have been working so hard at this for the last 2 years, and we finally there's been 2 arrears collection and current support collection that we have not hit 80% ever. And we decided that was enough and we were going to do it. So we've been working on it for 2 years. And if you can scroll down a little bit more, Tasha, we finally did it. All of our hard work has paid off. And as you can see there, in 2024, we were 83.79% in our arrears collection. We are the highest we have been in a long time for current support. Also, we're sitting at 72.93 end of last year. That is now our new goal. So we did get a little bit more funding for hitting that 80% in arrears. Current support, we have some really good ideas. We've brainstormed and some good ideas that we plan to implement in the next federal fiscal year. We need our family court commissioner and our attorney to get on board with us to make a few changes to things. And I think we've got them. I think I've got them convinced. So we are hoping that in 2026, we will be able to be at 80% in all of the categories. That's our biggest accomplishment. We've attended our normal trainings and collaborating with other counties and things like that, but that has been our goal and our goal that we reached. So we're very proud of that. Any questions for me about child support? All right. Well, enjoy my little graphs and stuff. It took me a long time to figure that out. I had to recruit the youngest one in my office to help me with it because I'm getting too old.
I was just to laugh at that fraternity establishment is over 100%.
I know, we're really good at that. We swab anybody that walks in.
I don't want.
When's, I don't know.
Okay, if there aren't any questions, then we'll move on to the Children and Families Unit.
So I'm Erica Pito, manager of the Children and Families Unit. So I started in January, but these are 2024 numbers. But so I'll just read the mission statement of the Children and Families Unit. So the primary goal of the Children and Families Unit is to provide services to families and children that facilitate the support needed to enable families to remain intact and or to protect the well-being of children. So a big highlight that I wanted to talk about was in 2024, we received 300 child protective services reports, which is a little bit down from 316. To me, that's not, I mean, it's not a big difference. But within there, when you break them down, so physical abuse was 99, neglect 117, sexual abuse 68, emotional abuse 14, and unborn child abuse 2. But the previous year in 2023, there were 12 unborn child abuse, which when I was like looking at these numbers, it kind of just stood out to me. That one did the unborn child abuse. So unborn child abuse is when, you know, someone is pregnant, and they're usually, you know, using drugs or alcohol, and there's suspected harm to the unborn child, which to me is huge for the community. Because hopefully we are seeing a decrease in usage that way, so then we don't have babies born drug dependent and that. I myself as a worker remember it being very busy in 23. You know, because usually a lot of times when children are, you know, drug dependent when they're born, it usually is an immediate removal and then working with the family trying to eliminate those barriers and that. So then you're looking at the reports, we go down to then 50 were screened in of the CPS reports. And then there were 7 substantiations. So saying that there was abuse or neglect that happened, that, you know, occurred. So then something else that stood out for me was out of home placements decreased from 43 children to 36. And then 13 children were discharged from out of home care and 8 were reunified with their families. Yeah, so those were like the big things that really stood out to me. Something also we're really working hard on, I would say, is the state of Wisconsin is really working the concept of family first, which is, and I think Jerry talked about this before. I became supervisor is like the light kin. So a lot of times for a child, if you're looking at, you know, placement and that, it's like, oh, you have to go to a foster home or a relative, but there might be established relationships already between family, you know, with families, like to someone that you're not related. So in looking, we're pushing like, okay, we can do that instead of going through that whole big process and, you know, pushing people away and say like, no, you already have that bond, you already have that relationship. So hopefully we can work together more with that. Any questions for me?
Yeah, so UW Extension
Yep,
has programs on relationships and parenting.
yes.
I'm just wondering
We-
if and how you interact with those.
So we partner with them a lot. We also have one position in the unit of a family support specialist, which does she will do, that position does parenting one-on-one with families, go to families' homes, and also partners with UW Extension and has done some joint trainings. We definitely give out to families that we're working with the flyers all the time of UW Extension. We also have, when children are in home placement, we have to do a review of the case, it's called a permanency plan review every 6 months. And the person that works for UW Extension does all the parenting. She's on our panel. So she comes to those meetings and she usually always, talks to the families too about what services they offer and that. So I think that there is a lot of partnership with UW Extension.
Yeah, that's great. They also have a lot on nutrition. Yep. Very useful to families.
Yeah. Yeah, it's a great resource.
Any other questions? And next on the list is Spark.
And Scott's not on here, but I think we announced last time we found out we got the funding for the next 3 years. I think one of the things just to highlight in there that you've probably heard us say before, we cannot prove it, it's not causation, but there's a high correlation between the number of children participating in Spark and the decrease in the number of community referrals to youth justice. Like I said, you can't prove it happened, but there's such strong correlation. We know it's effective. I just think, he's always trying new innovative things with kids, warm and welcoming to kids who maybe would be deemed difficult or nobody really wants to work with. Those are really the youth that he really takes in and wraps around, supports and gives lots of resources to and education. And we're continuously looking for new grants and he continuously gets them. But it's just a very robust program and I can't say enough about that program. So we're very happy to be able to proceed for the next 3 years with that funding at the same level.
Does Northern College closing impact Spark at all?
Not really. They were very involved with us when we first got the program up and running. And then I think it's just kind of been a little bit more, and like we were using a lot of their resources and now we've been able to establish a lot through the years, like our own kayaks and different kinds of equipment and things like that. And we have a big place at the AADC where, they've got a skate park and musical rooms and taping. I mean, it's gotten so huge. I don't think it'll have an effect, but they were very influential in the development of this.
Any
Big
other
question,
questions?
Terry. Matt Horning.
Go ahead, Matt.
Funding long-term, is there a vision to try to get this within the school district budget or shared between Health and Human Services and school district long-term? I know it's such a wonderful program and the grants have kept coming, which is great, but I know it's always a little bit precarious or feels tenuous. So I don't know if there's an update on the sort of long-term vision for it.
I get the feeling that other priorities other funding sources like the school having to go to referendum to pay their staff, the other priorities for the school would take precedence over this. And quite frankly, if the funding goes away, I don't believe the county can support the $300,000 program. So unfortunately, we never know, but we're hopeful. The other thing is, and we've been talking about this for a few years, is this is so successful that, we may be able to somehow use this as a model and create some kind of funding source as we show other communities how to do it to sustain it. But That's something we'd have to explore when we get closer. We've been thinking about it for years.
Do they get private donations like from different businesses or whatever?
They do, they get
Okay, yeah.
some and it's kept separately and they use it for non-allowable expenses in this program. Mhm.
Any other questions? And next is community service programs.
Hi, everybody. So our program mainly works with, well, it does work with people with mental health diagnoses or substance use diagnoses. And that's a requirement to come into our services. We provide a lot of just day-to-day functioning that people might need to be successful in the community. We coordinate a lot with children's unit and adult unit. With a lot of the people that they work with as well as us at the same time. Our goal is really to keep people in the community and help them be successful without having them placed somewhere or needing that extra assistance. Through the first, all the graphs that you'll see out of the gate and initially are really a lot of the demographics of people that we've enrolled through this last year. Some of our folks that we have come into the program, which you'll see, we serve multiple times through the year because they'll come in and might not be the right time for them to seek that treatment, or they might fall off our radar or get placed somewhere. So they can come in multiple times. There's no limit to how many times they can come into our program for services and support. So that's a lot of the first graphs. Some of our goals within CCS this last year, especially with the transition with Val retiring, was really to maintain a lot of our satisfaction scores across our MISIP survey that we do with all of our participants that have been enrolled over 6 months. Which through this last year, we not only did that, but with our children's scores, they actually improved tremendously through this last year. So our goal is to keep working that direction and looking at what other areas do we really need to focus on in order to keep that. Some of the big things that we have focused on through this last year is a lot of our improvements just in general for access to our services. So we now have our electronic health record, which is up and running. And we have also made a lot of changes in terms of insisting a referral to our program. We now have an electronic version of that, which has been utilized up until last week. We had gotten 33 new referrals just via that electronic format. So it definitely has opened the door for a lot of people to start that process and make it a little bit easier. So with that, we've also put QR codes, of course, on all of our brochures and everything that we have out there, and to make it easier for some of our participants, because everything's leaning tech savvy, so that has helped. And also through this last year, one of the big things is we have increased quite a bit of our contracted providers to provide services, which include offering things that are kind of outside the box. So we do the equine assisted support and services. We have yoga that can help with coping for mental health or substance use. Meditation and mindfulness. So we have things that are kind of outside of that normal scope that people can access through our program, as well as the peer support and just those day-to-day services as well. One of the other things that you'll see towards the end that we really, God, if I get to the end of all my graphs, is we have really looked at also, well, we kind of talked a little bit about it, but we've worked with Metastar a little bit in terms of seeing if they can help us just to sustain stuff with our EHR and everything moving electronic. We're kind of putting it a little on the back burner until we get settled in with our EHR, but that's one of the things that was within our goals. Any questions on any of the stuff within ours? Yeah.
Thanks, Terry. Economic Support Unit.
All right, well, my report does not have any graphs in it, sorry. Not so colorful. So just a couple of things that I wanted to make mention, when we think of economic support, I'm not exactly sure what everybody ends up thinking of, but for me, of course, it's food share, Medicaid, the Wisconsin Home Energy Assistance Program. And then I start to think about all the activities that the Northern Income Maintenance Consortium is involved with. That is the consortium that we are contracted with. Northern Income Maintenance Consortium does serve 12 counties in the northern region. So just a couple of key points here. Food shared, now this is just strictly for Ashland County. The annual amount issued for 2024 was $4,189,419.60. So when I think about that number, I start to think about that's where people are going to Super One, they're going to Walmart, they're going to possibly IGA in Bayfield, they're going to all of our local shops and they're making these purchases. So that's money into our community and into our economy. Our Medicaid numbers. So this is for basically Badger Care, EBD Medicaid, elderly blind disabled Medicaid is what that was for. In our Ashland County area, we have served 5,152 people. And the dollar amount that those services have come out to have been 49,848,503 dollars. So again, that is more focused on the medical, but that's still quite a bit of money into our community. For Northern Consortium, so this is the typical point of service for most of our residents. Not all residents can come into our agency and they can speak to an economic support worker. But typically we do have phone contact as opposed to the in-person. All throughout the 12 counties, they have had, the Northern Consortium has answered 104,375 phone calls in all of 2024. So that's a ton of phone calls. We've had over 29,000 applications. There's typically annual renewals. So just a lot of work goes into continuing these programs. For the Wisconsin Home Energy Assistance Program, WEAP or heating assistance, we've processed over 1,000 applications, and that's just strictly for Ashland County alone. So those are my highlights, short and sweet.
That Badger Care Medicaid program, that 5,152, those are unique individuals. That's not just.
Those are unique individuals. There is a possibility that a small number of those, like a very small number, would be unintentionally repeated just because of where we're getting the numbers, because like you and I could live in a household, but then maybe I don't want to live in your household anymore. I move in with Liz. And I'm eligible there.
That's nice.
I know. So I might get pouted twice just on your case.
From that to that.
And her.
Still, that's a third of our population.
It's a huge amount of our population.
Yeah.
And it's
Sure.
children, elderly.
Yeah.
So, yes.
With the heating and energy assistance, is there any education that goes along with that? So people can find ways to be more efficient or, reduce their costs?
With the heating and energy assistance program, when you're eligible for that program, you are potentially eligible for weatherization too. So if you are looking for weatherization, what can happen there? And I don't have the full criteria for weatherization. But what ends up happening is that if you are interested in weatherization, that goes through Ashland County Housing Authority, and they would send somebody out to evaluate your home and basically take a look and determine what types of changes you could make to be more energy efficient. With that being said, not every home is at a structurally sound basis to have things like new windows or insulation, because it wouldn't make an impact. Any services that they provide have to be able to make an impact on the person's energy usage and their energy costs. But we do talk to people. I mean, we have crisis, we have individuals who come through and, they have a high bill or they have an LP bill and they can't get any more fuel in. And we do talk with them a little bit about, budgeting, making payment plans, letting them know that most vendors, most of them do have the option for doing like an annual budgeting. So that way, when you have your high winter costs, you can kind of spread that out a little bit over the summertime. And then your bill is a little bit less of a surprise. So that can sometimes help folks as well.
Is there anything in here for cooling in the summer?
That is also taken care of underneath the Wisconsin Home Energy Assistance. Now you're kind of digging into my economic support update. With last year with the cooling, we also did help people get assistance with getting their currently existing central air, so related to their HVAC systems that were not functioning or were not functioning properly. We did assist with getting referrals out to get those repaired and taken care of. However, this year, they have put a halt on that particular program because it is negatively and unexpectedly impacting the budget. So there's a halt on that right now.
This is the last question. Is there any financial kind of programming for replacing equipment? Like heat pump is a more efficient way of heating and cooling, but it takes an investment. People in these conditions don't have the funds for investment. Are there any programs to help them finance something that over the long run would be more efficient?
So some of that may fall underneath the weatherization category. We don't replace or repair, well, okay. If you have an HVAC system, for example, that is not functioning, then we can come in and we can do a potential repair replacement. If it's just not working to optimal standards, that's a different story and it becomes homeowner responsibility.
Thank you.
Yeah.
Any other questions?
Next time, guys, list with pictures.
I know, I think.
You're not the only one.
I just throw anything in there.
Just figured you guys just wanted to hear me talk.
Next up is the fiscal unit. Amber.
So, mine is kind of short and sweet, but that's because you guys get to hear from me at like every meeting. So there's not too many surprises, but we have been since I came on, we've been working on getting out of our old accounting system onto the new EHR and using the Springbrook accounting system, the county one that we're using. So we are kind of into the final stages of that. And I think it's been a lot of work, but very hopeful, and it's going to be really nice when we get all that done. So we'll keep working on that through the rest of this year, and hopefully, I mean, my hope is that we'd be done using the old system by the end of the year or shortly after. So I think that's a good plan. Otherwise, as far as everything else is kind of staying pretty much the same, besides us working through the new EHR, getting the programs rolled over, and it's been going pretty good. It's been a long, slow process, but we're getting there. I also don't have any fun charts or anything, but are colorful. But does anybody have any questions for me?
Hey, thanks, Amber.
Mm-hmm.
Public.
All right, I have all of the charts and the fun stuff for you. So the public health portion of the annual report does take up approximately half of the entire annual report. So please, by all means, take it home, take the time to read it. I will give you a very, very abbreviated Cliff Notes version because there is a lot in it. So some of the highlights from the past year, so we traditionally partner with Bayfield and Iron counties and Tamarack Health to complete our community health needs assessments, which then we use to develop the community health improvement plan. So we did complete that assessment and the plan development throughout 2024. We actually had the largest number of survey respondents with this past cycle that we have ever had, ever. There were over 1,000 survey respondents with this last cycle. Previous cycles we saw, so it's every 3 years that we do it. So the previous one, there were like 800 people. The one before that, there were like 400 people. So we definitely got a significant amount of community input between Ashland, Bayfield, and Iron counties with this last cycle. So two primary goals that come out of the whole thing are awareness. So our action item for that is we are going to conduct a SWOT analysis, so development of strengths, weaknesses, opportunities, and threats, to try to effectively find a way to communicate regarding community activities and resources through the Tri-County area, including different medical providers and opportunities the variety of resources, all of which have been essentially discussed by all of the different units so far tonight. And then to continue with collaboration, expanding on a existing mental health community coalition that we already have in our region, to try to further the reach of that and make any improvements and outreach that are possible through that existing coalition. And I'm gonna skip ahead a few pages here for my sticky notes. Communicable disease. COVID-19, you can see on the graph here, the number of reported cases, it has significantly continued to drop down over the past several years. Total investigations that we had for 2024 was 686 different reported communicable diseases. So staff, everybody kind of takes a specialty for what they investigate, and we do the phone calls and the follow-ups for the various different diseases reported. Lyme's disease and Lyme's laboratory reports were one of the highest number of cases for individual diseases aside from COVID-19. Hepatitis C, whether it be acute or chronic, came in at 28. Our chlamydia rates for Ashland County actually went back up this past year. We had 27 cases. Different E. coli variants, there were 17 different cases associated with that. We saw a pretty significant increase in pertussis this past year with 13 confirmed cases reported. And hepatitis B, there were 10 investigations associated with that. So other communicable disease information, we did have a fairly significant increase in the number of Manto TB skin tests that we administered and coordinated reading of results for this past year. A lot of that was associated with active disease investigation that was conducted throughout the year. We had a couple of different occurrences that required a good bit of monitoring, so. Next sticky note. Under immunizations, just kind of wanted to call attention to the influenza vaccination rates. I know we've previously talked about this, but our immunization rates continue to trend down over the last several years. Page 59, if you're looking.
Yeah.
So this past year, total immunizations that we administered was 446. So you can see things have kind of bounced around a little bit over the past several years, but overall the trend has been going down. And this has been something we've been seeing statewide, nationwide, as far as declining immunization rates, not specifically just influenza, but it is a very reasonable one to call out because we have, annual flu season, so. To try and combat our declining immunization rates, we had applied for and were a recipient of the RICE grant, which is the Routine Immunizations Through Community Engagement Grant. So we had completed a lot of individual outreach for different age groups, sending out individualized letters to families of children who are behind on their routine childhood immunizations. We did see some positive effect following this, with the immunization rates actually moving up. Some people did call us to let us know that they had moved out of the area. Please stop mailing them stuff. So there was some positive outcome from it. Unfortunately, early in 2025, the funding for the RICE grant was called back, and is still kind of yo-yoing back and forth. So we have essentially halted activities for the RICE grant into 2025 just because of the question of not having funding available for it anymore, so. We continue with our family planning and reproductive health programs. We actually have several different funding sources that all roll into family planning and reproductive health. We are a Title X clinic. We also provide GYT services or get yourself tested. We had historically for the last several years been doing a once monthly clinic in partnership with Northland College during the school year. Open to the public, but predominantly Northland College students did attend that. We have pivoted in the spring of this year, providing clinics at Northland College while they remained open, but going into 2025, we have actually partnered with Bad River Harm Reduction, and we are now providing once monthly clinic with Bad River Harm Reduction. Along with that, as I mentioned previously, we did notice an uptick in some of our STI rates. Correlating with that, we also have noted a decreased number of the free condom dispensers that we have available in the community. So when we initially put the condom dispensers out, we saw our STI rates go down as the condom dispensers have decreased because some businesses have closed. They don't want them. They're just, there aren't as many going out. We've seen the STI rates creep back up, so we now offer condoms through our public health vending machines, and we are hoping to see a correlation of decreasing STI rates again. And along with the public health vending machines, I think that's probably one of our biggest success stories for the past years, the vending machines. We had 3 vending machines active at the end of 2024. Overall, it's been, I'd say, a fairly positive response from them. Looking at our Narcan distribution from 2023 to 2024 on page 67, you can see there's a pretty significant increase in the number of doses of Narcan that have been distributed throughout the community. And that's just the supply that we are putting out. Bad River Harm Reduction continues to have their Narcan distribution programs as well. And, there's a few other resources in and around the area. So we are hoping to, see continued improvement and decreased overdoses as time goes on associated with that. Working on continued funding sources to try and continue to have supplies, and finding alternative things to include in vending machines such as tick kits for this year. So our environmental health programs have remained pretty steady. Nothing pretty steady as far as those go. And then I just wanted to highlight that we do continue with our walking clinic activities. So we have a designated nurse on call each day. So if somebody comes in on a walking basis, whether they're coming in for a TB test or, I stepped on a nail, I need my tetanus shot, or they got a friendly letter in the mail saying your child is behind on immunizations, blood pressure check, whatever it happens to be. We do continue to offer those services and have staff available to cover any walk-in sort of needs, sharps collection and that sort of thing as well. And that is a very Cliff Notes version for you. Do you have any questions?
Well, go ahead, George. No, I would say there's some beautiful feedback here on the last page.
Yeah.
You get any complaints?
I don't have that many pages. There is generally reluctance to accept occasional educational opportunities, and I am occasionally the scapegoat for that.
So it's more pushback than a complaint, yeah?
It can go either way.
Thank you.
Rich?
On that, with all your cuts, you mentioned that with the cuts coming, or some of the cuts that have already came, you're affecting some of your programs. So how many programs are affected by these cuts and stuff? The ones that are in place and the ones that are coming down?
So far, some of the primary areas have been our immunization program. We have a tentative budget approved for our Title X program.
It's kind of a goofy one for the cycle. The grant period for it actually runs April 1st through March 31st, so it overlaps. So I have tentatively have a budget approved for 25-26, but I do not have a contract for that.
Okay.
So we are hoping that the funding that we are approved for will actually go through. Our that public health emergency preparedness program, that one runs on the federal fiscal year, so that is supposed to be July 1st through June 30th. We have nothing.
Yeah, nothing?
There's a lot of talk.
Yeah.
We have not seen the black and white of any contract of any sort at this point in time. And we are part of we're members of the Healthcare Emergency Readiness Coalition and the Western Wisconsin Public Health Emergency Preparedness Coalitions. They are very nervous.
Okay. Yeah.
Some of the proposed budgets that we have seen essentially had a zero for preparedness funding, which has happened many times in the past. As they're going through negotiations, they managed to get that zero up to some funding amount. But it has been a very slow process thus far. Usually we have at least something at this point in time, but
nothing yet.
We're a little nervous about that one. Those are kind of the main ones.
What about that? Didn't that, for SNAP, didn't that work thing go into effect yet where you have to have, if you're a certain age, you have to be looking for work and so that, did that come to effect yet? Or that's you, Wade?
That's an age question.
No.
SNAP food share in the state of Wisconsin already has an ABOD, an able-bodied adult without dependence work requirement.
Okay.
So if you are within a certain age range, I want to say that age out is 62 or 64 now. I'll have to check the handbook.
Okay.
But if you're under that age and you do not have a minor dependent, so 18 or under 18, so 17 or younger, in your food unit, then you are required to meet that 80-hour month work requirement, or you can participate with the food share employment training program called FSET. Or you can be self-employed, or you can volunteer, any combination of those four things.
Oh, okay, and that's in effect now.
That's in effect now, and it has been for several years.
Okay. Thanks. Okay, thanks.
Any other
This is
questions?
Elizabeth. Yes, I had a question.
Go ahead.
For the food stamp program or Medicaid, you said something about they have to be able-bodied to work or whatever. Do we know anything about the homeless community? Have they applied for benefits? I mean, as far as summer, are we gonna see fewer homeless because they're trying to, get themselves together or whatever? I'm wondering, how is this gonna affect people that are drug users and they just can't get their lives together and they can't work with their benefits?
So that is a really great question, and now you're making me look it up in the handbook so I can give you the exact answer. So there are exemptions to the rule, of course. Let me get those. And I do believe for the ABOD, and pardon me, there's two different work requirements for food share. There's work registration, and then there's the ABOD one, the able-bodied adults without dependence. And I want to say that for the able-bodied adults without dependence, I do believe that being homeless is one of the exemptions, but I don't want to talk out of turn here.
And thank you for all your hard work and feedback. Do you know, does NWCSA, the Millie's program and Ashland County Human Services go directly out in the field and talk to the homeless or anything? I know it could be a dangerous thing, but there are some that, like the women and everything, if they're not using, to find out, what areas could they, if they wanted help, they could get it, You know what I mean? Like, has anybody really went out there to talk to them?
I will say for CCS, we have done that. We tried for a couple months going out to meet the homeless, put up flyers, all the above, and we got no response. We did a lot of it in the downtown area, which is kind of more that common area. But there was no response. No one showed up to any of our outreach. We kind of put flyers wherever we thought people might be going or staying for the day or anywhere we could.
And we were going in person.
In person, we would sit for a couple hours. Waiting if people would show up. We had resources, all of the above, and
It didn't work.
nothing. Yeah.
Thank you. I know it can be a daunting thing and potentially dangerous too, so thank you.
And then Liz, to answer your question, food share handbook, and it is available online for anybody to look up. I just Google Wisconsin food share handbook and it comes right up. Chapter 3.17.1.3, determining food share exemptions. Chronic homelessness is underneath one of the exemptions. So as long as whoever we're speaking to reports the fact that they are chronically homeless to us, then we can grant them the exemption from the work requirements.
Thank you.
Any other questions? Now we'll move on to building roof update.
All right. I had to jump ahead there. So about 2 weeks ago on a Tuesday, we had some rain, and not only outside but inside. It was streaming down the windows, coming out the outlet, on the economic support side of the building, so past this reception area on this side. The county maintenance man, Dave, came over, he inspected it, he crawled up there and he took pictures, and I don't have them here, but they were posted on the finance meeting. If anybody's interested in seeing the photos, they're there. So this kind of was put on our agenda early, and then it went to finance before, so this is kind of a horse before the cart kind of deal. Cart before the horse kind of deal. So anyway, his assessment at the time, and he did try to slip some shingles back in place, which has helped temporarily because we've gotten rain since and it's been, knock on wood, okay. We had to relocate some people for safety purposes, obviously. And he was gonna put a temporary patch on it just until we could figure out what to do. His assessment was at least this side of the building where he inspected is in really rough shape. The shingles are peeling up, the wind caught under them, it's missing lots of shingles. You can see in the pictures, they were kind of sliding down in spots. His assessment was we need a new roof. It did go to finance. Finance discussed it and determined they want to get some professional opinions on that and bids on what's necessary. Can you patch it? Do you need a new roof? Those kind of things. So that's where we're at with that. We moved into this place and it had just been remodeled and fixed up completely before we did. That was in 2006. So the roof is about 19 years. It's kind of lived its life expectancy at this point. Parts of the roof over public health on that side of the building are metal. This is asphalt shingles. So stay tuned. We'll figure out what we need to do. And of course, it's high construction, peak construction.
Oh, yeah.
Season, so
Be hard to get somebody.
yes. So we'll update you as we know more.
Okay. Economic support update.
Okay, that's me again. So, what I wanted to update this group on is that, as of the next fiscal year, so starting October first, it's considered the 2016 fiscal year for the Wisconsin Home Energy Assistance Program. That will no longer be administered by Ashland County. Part of our reasoning for not entering into the contract, with them for next year is because of a funding issue. The way that they are currently determining how much money that we end up receiving is based on the number of applications that we receive. We are in a little bit of competition with ESI, Energy Services Incorporated, because they complete applications online. And a couple of other changes have been that there's additional time-consuming work involved with the applications, with the program services, which is the furnace repair referrals, and summer fill. And due to that, we have been getting through our funding a little bit sooner in the fiscal year than what we would like to. The last 2 years, they have noticed and have given us some more money when that's happened. This year, we had to ask for additional funds. If we don't have those additional funds, then it's got to come from somewhere to pay people to complete the work. So with that in mind, and some of the trends along with cuts, we have decided not to administer the program for next year. We will complete our contract year through September 30th. And still serve our residents and are still serving our residents. But starting October 1st, our residents will be able to get their services that are available at West Cap is the new agency. I just found that out today. So they'll still be able to get the WEEP program. They'll still be able to get those services. They'll still be able to do the program services for the furnace repairs, replacements, the cooling, the water heaters, and water conservation program. But it just simply won't be through us.
Another factor in that on the federal level, it's called Low Income Heating Assistance Program, known as LIHEAP. There is no funding currently. Now, a lot's at play. We anticipate there would be such pushback, especially in the colder climates, if you don't help people not freeze to death in the winter. But that was cut. Like I said, there's lots of movements, so we're hopeful that will come back in, but that did play into our decision as well. And as Amy mentioned, we had to ask for money this year, but I would just add that we didn't ask for money. We told them we were going to not do the program anymore. Then they asked us why. We said the funding isn't sufficient enough. And then they said, oh, well, we'll give you some more money. But not until we told them we were not going to do the program. And technically, we could give them 30 days notice. And they would have to take the program back. So they wanted us to keep it. So then suddenly the purse strings were a little more open. But I think they were very concerned on the state level from the Fed funding coming down as well. So that played into our decision as well.
Nothing's for sure.
No.
Outlook.
No.
Any questions about that?
Okay. And then the only other thing I just wanted to make mention is if you guys haven't had a chance to in the written materials, as a positive in the economic support world, we did successfully complete our MER, which is our management evaluation report for food share for SNAP. So the Northern Consortium is audited. And specifically this year, Ashland had a virtual on-site visit. It sounds a little bit like a oxymoron there, virtual on-site, but basically I ran around with a laptop and and showed everybody everything that we had. And the review went very, very well. So if you have an opportunity to take a peek at that, and if anybody's interested in the full report, I will be more than happy to furnish it and go over it. Yeah, that's some excerpts from it.
Human health hazard update.
Yes, I wanted to provide specifically an update on a couple of the human health hazards that we've had recently. Due to the severity and the circumstances surrounding these two particular human health hazards. The property owners would have the option to appeal to the board if they would wish to do so, which is why I specifically wanted to provide updates. We have had a recent influx of human health hazard complaints. Through in the investigative process, two properties within the city of Ashland have actually been placarded as unfit for human habitation effective on May 30th. One of these properties was due to a significant rat infestation, and the other property was due to the presence of hazardous and toxic substances. Since that time, the City of Ashland building inspector has actually visited both of the locations and has provided a recommendation for a raise order for both of the properties. So the City of Ashland will be following up with the orders, the additional placard, notification and newspaper posting for each of the locations.
Next is lead safe.
Let's
Homes
say
grant
homes, that's
update.
me too. Yeah, I'm just gonna keep going here. So the Wisconsin Lead Safe Homes Program, we have been a grant administrator for the Wisconsin Lead Safe Homes Program for the past several years. They revised the application process for this past year, so we had to complete a new application. I think it ended up being 28 pages by the time it was done. We were successful in our reapplication to the Wisconsin Lead Safe Homes Program, so we will be continuing as a local grant administrator for that. Which is excellent because we are actively working with a property identified as a lead risk with two children present with elevated blood lead levels. So we are awaiting contract negotiations to determine future funding for the program. Our funding has varied quite widely over the last several years. It depends on if we're working on a project or if we're doing staff training or a combination thereof. 2 years ago, I believe our funding allocation was to $150,000 because of construction project we were working on, so it just kind of depends on where we're at. There's a lot of negotiation back and forth with it, so. But
Does that include, do you replace their water line from the road into the house?
there is a separate grant
For that.
funding source
Yep.
specifically for the water lines. We primarily do the primary residence or daycare. If the child spends, there's certain qualifications, the child has to spend so much time within the residence.
Yeah.
Whether it be their, daycare, grandparents' house, auntie, uncle, primary residence, that sort of thing, so.
So just, things inside the home, more or less. Fixtures.
Inside the home, outside the home, the
Oh,
project
okay.
that there's a lot of lead paint. The one that we're working on right now will actually also, require removal of, a certain amount of soil around the drip line from the property. And then replacement with topsoil and, I don't remember the measurements. It's a
Oh.
crash course in construction.
Yeah.
But a certain distance of drainage rock will then need to be placed around the border of the home as well, because the soil samples did test positive for increased levels of lead. Presumably from the lead paint
Yeah,
that has been
lead
dripping
paint.
off of the house.
Okay. So,
Any other questions for Liz? I think she's got the next one too.
I,
Public health general update.
so, in other news, for our maternal child health program, we had switched grant objectives this year. So this year we were focusing on, or are focusing on physical activity and nutrition in children and adolescents. So one of the things that we have done is, we partnered with Ashland Parks and Recreation and the City of Ashland Police Department and EMS to try to extend the reach of the bike rodeo, which was held on May 30th. We were able to utilize grant funding to contribute 50 additional bike helmets to try to increase the number of bike helmets distributed. Historically, they run out of bike helmets within like the first hour of the event. They go so quickly. So this year they actually had 187 helmets to be given out, which is the greatest number of helmets that they've had available. At the end of the event, we had successfully distributed roughly 140 helmets. So there are still a few left over. There were also some of the older kids that attended that were given helmets that then took them and tucked them around the corner of the building. So those were recollected. So there are additional bike helmets that would be available through Parks and Rec if anybody is in need or knows a child that is in need. That those will continue to be given out throughout the summer. Variety of sizes, anywhere from toddler all the way to adult sizes to accommodate any size noggin. So. I wanted to share COVID-19 vaccine updates as there has been some discussion regarding recommendations for that. So for Wisconsin DHS, we continue to recommend the current COVID-19 vaccination during pregnancy and for every person 6 months of age and older to protect from serious COVID-19 illnesses and to prevent spreading it to others. The current vaccine is safe during pregnancy, and vaccination can protect women and their infants after birth. Newborns are dependent on maternal antibodies from the vaccine for protection. Wisconsin will continue to cover the current COVID-19 vaccine for eligible Medicaid members, including children and individuals who are pregnant. So it is still recommended to receive for every person's.
Oh.
Measles updates, there are currently no cases of measles identified within the state of Wisconsin that we are aware of. We had a tabletop exercise with Tamarack Health at the Ashland campus on Monday, and I would say it went pretty well. We've been distributing information to our local clinics, and we are having discussions with Schwamigan Clinic about potentially doing a tabletop exercise with them as well. But any updates that we receive, sending out to all of our local providers and trying to encourage immunizations where we can. So, what else did I have? Another grant update. We had applied to the Division of Care and Treatment Services Drug Checking Technologies Program, and we were successful. So we will be receiving additional supplies of fentanyl test strips and fentanyl test kits, as well as xylazine test strips and xylazine test kits to supply through the vending machines. We'll be getting those through that grant funding source. And then the last update that I had is the Wisconsin Coalition Against Sexual Assaults has actually asked if I would consider being a presenter in collaboration with Planned Parenthood and Health First on available services through our Title X clinic. So obviously, with the current question regarding funding, there is concern about services specifically for individuals who sexual violence services being threatened, as well as reproductive health care services in general being threatened. So we would be hopeful that this webinar would be beneficial for advocates to understand the reproductive health landscape across the state, with the goal to show how much reproductive health clinics can support survivors of sexual violence, including and beyond for all different aspects of care. That's the end of my update.
George.
I have a question about the maternal and child health.
Yes.
So in the annual report, it shows this downward trend in referrals. I just wondered if that correlating with anything like vaccine hesitancy, or what, is there any thought behind that trend?
The maternal child health program and prenatal care coordination program kind of run one into the other. So PNCC is your, a lot of people, when you think public health, they think of the good old fashioned traditional baby home visits where the nurse goes to visit the mom in the home, that sort of thing. That is what the PNCC program is, the prenatal care coordination. So we actually still do the home visits for expectant families where we can help monitor weight, monitor blood pressure, connect them with resources, provide additional information, the whole gamut, whatever we're able to assist them with, we will do home visits to help with that. And then after they have the baby and bring baby home, there's a transition period where they're still covered under the PNCC program for 60 days. And then it transitions into the maternal child health program, where we can continue to see them for a period of time after they are home with baby to monitor baby's growth and development, do weight checks, monitor length, head circumference, provide information on developmental milestones and things like that. Over the last several years, we have seen declining referrals for the prenatal care coordination program. One of the requirements is the individual has to be enrolled in Badger Care Plus to be on the program. Maternal child health, it doesn't matter the funding source, the grant funding pays for the services for us to go visit. But we have noted a trend where the referrals, the individuals are more complex as far as the potential barriers that the individual is facing, whether it be a difficult living situation. We've encountered individuals with experiencing homelessness, mental health conditions, substance use. It's more and more compounding and complex, and we've had several cases where individuals flat out refuse services, or they're lost to follow up. They're no longer at the address that they had provided. They no longer have the same cell phone number. They don't answer their phone. They vanish on us, essentially. They're still in the area. They just don't make contact.
Can you tell? Yeah. Can you tell if the request for these services is proportional throughout the county, proportional to the distribution in the county, or has it become area specific that you get requests from? Can you tell? Maybe you can't. I'm just saying we have some diverse types of communities in different parts of the county. I'm just wondering if there are some communities that are taking advantage of these programs and some communities that maybe are not. I just don't know.
I'm the current caseload that we have, I know the distribution is actually more in the southern portion of the county right now. But I know we've also had referrals and clients from Madeline Island. So it's
Good, thank you.
kind of hit and miss from where.
Any other questions for Liz?
This is Elizabeth Brannick. I had one.
Okay, go ahead.
About the Northland College closing, is the Burke Center still open and operational, or who's gonna do the beach, testing and beach advisories?
We subcontract with the DNR for the beach monitoring program. So we had conversations early in the year with the Burke Center, and initially it was looking like they were going to be able to continue to do the beach monitoring program for us, but after some crunching of numbers, staffing, they just weren't going to have the capacity to be able to do it. So we are actually contracting with Bayfield County Public Health. They're actually able to run the labs in-house for us. So Bayfield County is running our labs for the beach monitoring program this year.
Thank you.
Anything else? We'll move on to the written materials. Anybody have any questions or comments about the written materials that are in your packet? If not, board member updates and future agenda items.
It's your agenda, long-term planning. Plan trends. Really interested in asking about trends that we see developing. So maybe we think about that. I have some thought about that by next time.
Any other business? Now we get to our second public comment period regarding the comprehensive plan discussion, which we really didn't have anything other than.
And you don't have any public comments in the.
Didn't have any public comments.
Surprisingly, nobody's busted in the door.
Next thing we have to do is adjourn the public hearing on the budget.
I'll make that motion.
Okay,
I'll second it.
we have a motion made and seconded to adjourn the public hearing on input to the budget preparation. I don't know if we have to do a roll call or if we can just do the voice.
That'll tell you.
She was gonna help. Perfect.
We have this in hands. We've done
Yeah.
that. Well,
Those are roll call.
Why not?
Do a voice vote.
This is,
All right. Clarence Campbell,
yes.
Richard Huber.
Yes.
George Busse,
Yes.
Laura Negro,
Yes.
Dr. Keller,
Sure. Yes.
Dr. Horny,
Yes.
Joy Henderson,
Yes.
Elizabeth Franick,
Yes.
and then Laura Cruz.
Okay, so the next meeting date, August 27th. There's no further business. We'll need a motion to adjourn. We don't need it. But
Move to adjourn.
We just read it.
I'll second.
okay, motion made and seconded to adjourn. All in favor?
Aye.
Opposed?
Aye.
That was to adjourn.
Escalate. Escalate.
I'm just gonna vote. Nay.
We're adjourned.
Good to see you.
5 more minutes.
No, I can't adjourn.
That person in the meeting.